thing does that.
Okay, we're scanning the room now. It's clear.
Hi, my name is Mariatu Sangari. I'm doing my video, my didactic video for nursing 210. I want to introduce to you Alaji, who's going to be my patient for this assessment class. So how are you, Alaji? Hope you're doing fine. So I'm going to explain as we're going along. I'll explain what we're doing. It's going to be a long tape because we have a lot to do here. First, I'm going to start with the assessment of your skin on your upper extremities and lower extremities, okay? So bear with me. So I'm going to inspect your skin and temperature and look for any asymmetric, you know, and palpate also your skin, okay, for upper and lower. I'm looking. Can you put your hands out for me like that? Thank you. Inspecting your hand. I see that the color of the skin on your upper extremities is even. It's brown and even. I don't see any discolorations. I don't see any tubules or vesicles. And I'm going to inspect the lower extremities too. Can you just, yeah, stick out your feet for me, please? Both feet. I'm going to check the color of the skin, which is brown also. And I see that the hair, you have hair on your skin, and it's evenly distributed on your legs. Thank you. And I don't see any lacerations or any wounds. Skin is normal. Thank you. So my next thing after inspecting is I'm going to palpate in your skin here. I feel your skin is normal temperature. Do you have any fever? Oh, okay. And palpating your, I'm going to palpate, I'm palpating your wrist and your ankle, and well, starting with the upper extremities. I'm gonna, excuse me, palpate and actually check the skin toggle here. And do the same thing over here. Seems like you have normal skin toggle. It's going right back to its normal position. Skin toggle, I don't see any signs of dehydration. I check down here too. Okay. Skin toggle looks good, no signs of dehydration. And I don't see any lesions on your skin. Okay. So temperature is normal. I feel normal temperature both upper and lower extremities. So now I'm going to check for the next thing I'm going to do is check your nails and your fingers to inspect them and palpate them. Okay. I'm gonna okay, let's see. So I'm gonna check, palpate your nails and the upper nails and the toenails, and check for your lower extremities to see if you have any lacerations and edema and that kind of stuff. Okay, so I'm gonna palpate your nails here. I see that your nail bed, you have that white on the nail bed. Your nails are your capillary refill on your nail. It's normal, it's less than 2 seconds coming back, and it's pink. And your nails are diamond shaped. I don't see any clubbing on the side, and the nail bed are evenly distributed and clean and downwards, which is normal, and diamond shaped. I'm going to check the other side of the fingers. Capillary refill is normal. It's less than 2 seconds, and your nails are pink. I don't see any clubbing. I don't note any clubbing. Okay, and it's diamond shaped. So I'm going to check your toes here, down here. I don't see any edema noted. I don't see any wounds here, and your nails evenly distributed. Check the other foot. Thank you. Thank you. No edema noted there. Thank you. So my next thing, I've checked the upper and lower extremities, and I've done the nails also. So now my next step is to check your head, face, and the scalp. So I'm gonna be doing that just to inspect and palpate. First, I'm gonna inspect your head. Okay, I'm gonna have you sit up straight and look at me. I see that your head is normal shaped. It's medium to large head, and it's round. And I don't see any. It's symmetric. That means the one side is equal to the other. And I see that I don't see any temperature. It doesn't feel like a normal skin. And now I'm going to palpate your head. Just see that your hair is black and evenly distributed. It's thick, although it has a nice texture to it, a smooth texture. So now I'm going to scan, or just palpate and look for any possible dandruffs or anything. I don't see any dandruffs. I see also that you don't have any lesions or papules, what we call boils. I don't see that. Look on the other side. Clean scalp, no dandruff noted. Okay. Thank you. Okay, so now that I've checked your head, it's round and everything, you check your scalp and the size of your head, palpated your hair. I will now go into details to palpate your face and your nasal sinuses. Okay. All right. Now I'm going to concentrate on your face, Olaji. First, I'm going to palpate your nasal sinus. Do you have any pain here? Okay. I see that your nose is right at the center of your face. And let's see. So I'm still on the head. And we're going to do the, I've checked your sinuses. I've checked it. Now I'm going to do the motor, temporal, and mandibular, and masseter, and then I'll do the ophthalmic. Okay. So thank you for being patient. Okay. I'm checking here, checking the side of your head here. This is your mandibular. Try to open and close your mouth for me. Okay. Again. Alright? Your mandibular muscles, they move according to opening up your mouth, which is normal. Okay? Alright? I'm going to go ahead and check your head and your neck and the strength of your head, the neck muscles. Alright? So I'm going to try to push your head forward and you're going to try to bring it back. So, check the strength of your neck muscles. So I'm going to push forward while you push back. Good. Good. Okay. I'm going to push your head backward. Thank you. Good. And the side. All right. And this side. Good. All right. I'm going to try to bring your chin up or you bring your chin down. Okay. Good. All right. Thank you. So now I'm going to check your neck. Oh, before I do that, can you smile for me? Okay. Any pain while you're doing that? Can you frown? Okay. Any pain while you do that? Okay. Can you, like you're blowing a balloon, can you bring out or bust out your cheeks? Mm-hmm. Any pain while you're doing that? All right. Okay. Thank you. So now I think I will do the mouth before the neck. That's right. I'm going to ask you, I'm going to wear a pair of gloves because I don't want to put my... Thank you for being patient. So now my next step is I'm going to check your mouth and your teeth and those kind of things just to be sure that we don't see any signs of infection and all that kind of thing. So I'm going to ask you to open your mouth wide for me, please. Move your tongue for me, up and down to the side. Okay, the other side. Good. I'm going to ask you to say ah.
Ah.
Yeah. That. Open. Okay. I see that your mouth is moist and it's pink. And can I see your teeth? I'm going to look at your gums. Okay. I don't see any swollen gums. No signs of gingivitis. And you open your mouth again for me. Lift up your tongue. Okay. That's pink. And in the center, there's I'm checking for your sublingual as well as your ovular to see whether they are where they should be. Okay. And I see that you have lips. Your lips are even, upper and lower lips, and they're pink. Hey, put your tongue down for me, please. I'm going to look to the back. And your palate, pink also. The whole mucosa is pink and moist and looks normal. Thank you very much. And now I'm going to take a look at your well, before I go to your eyes, I have not checked your pulses. I need to check your pulse. I can. No, I'm so sorry. I think I will come back to that. My next step here is to check your eyes. So we have a lot to do with your eyes. We have to check for well, I had to explain to you, I just discussed with you the Snelling test. So the Snelling test is a test that is used to measure visual acuity, like the normal Snelling test for normal eye vision is 20/20. So anything that deviates from that 20/20 is either is not normal. And there they have people that are short-sighted and people that are long-sighted, and that's what the Snelling test is about. And the Rosenberg test is a test for the nearsighted. That's an test for abnormality for nearsighted. And the peripheral test, that one we have to do, the peripheral visual test. I'm going to ask you to tell me if you see. I'm going to ask you to close one of your eyes and tell me if you see the object. Okay? Let me shut this down before I use the battery. Okay. All right. I'm going to ask you to use this to cover one eye. Okay. And I'm going to use my pen. Let's see. Okay. Can you see this object? Can you see the pen? The pen on the side. Okay. Cover the other eye. Just cover it completely. You have to cover it completely. Okay? Can you see this pen?
No.
Can you see it here?
Yeah.
Okay. All right. Thank you. Next, I'm going to ask you to. That was the peripheral test. And next we're going to do the six cardinal position test. I'm going to still use my pen to do that. Okay? The six cardinals. So, can you see that? Okay. Okay. Can you see that? Look at that pen. I'm moving the pen and you follow with your head straight, and don't move your head. You're gonna follow this pen, okay? I'm gonna move the pen and you're gonna follow with your eyes only, not with your head, okay? All right? I'm checking your eyes while you're following that pen, okay? Okay. Good, thank you. So, that's the six cardinal case. And now I'm gonna check the reflex on your eyes. I want to see the reflex, how you react to the light. Okay, how your eyes will. Keep your head straight. Okay. Open your eyes wide. Okay. I can see that when I do that, you'll have a quick constriction of your eyes. I'm going to check the other one too. Okay. Did you open it first? At first, open it. Okay. I can see the constriction too, which is normal. So you have a reaction to the light. So now I'm going to inspect and just inspect your eyebrow, eyelashes, and peripheral fissures, and the lacrima, and all those things. Inspect the pupils and response to light. I just did that. Here is the distance lacrima. Okay. So inspecting your eyelids, I'm just inspecting your eyelids here. So I want to try to open your eyes with my finger while you try to close them. Okay. I'm going to do the other side. I'm trying to open them, force opening while you're trying to close them. Okay. And I thought your lacrima, I'm checking, I'm palpating, I don't see any swelling. You look normal. Oh, don't resist. I'm just checking your upper eyelids and lower eyelids. I see color here is pink and moist. Okay. Moist. Okay, good. Thank you. The next thing to do, the color, let's see. Your retinol, I'm gonna check, open your eyes again for me. I don't see any signs of bleeding, no hemorrhage. Open, actually, open wide. Are you tired, huh? Open wide. Yeah, open wide so I can see those retinol. There you go. I'm so sorry, I'm putting that light on you. Open wide. Okay. I don't see any signs of, no signs of hemorrhage on the retinol. So, and I'm trying to see what else I need to do for the eyes. Regular, retinol. Okay, I think that's it for the eyes. I'm going to check your ears now, and ears and nose, going down, and then check your neck. So I'm going to look into your ears and see if there are any signs of infection. Okay, so I would inspect the mastoid area, the auricle, and I'm going to look into the canal to see if you have any build-up wax, which we call serinium occlusion. And I'm going to look for the membrane to see whether that's a tympanic membrane, to see whether it's flat and gray color, which is a normal color for the tympanic. So I'm going to check, that's what I'm going to check all in your ears for that. Okay, and then we'll do the whisper test. Okay, so I'm going to ask you to keep your head straight while I check into, I see that, yeah. Yeah, I see the gray. The tympanic is gray. Just normal, I see some grayish. Okay. And I don't see any wax buildup, serinium buildup. Good. I'm going to check the other ear. Alright, good. Same here. I see symmetry. Okay. And I don't see any wax buildup on either side. So I'm going to now do the whisper test. I'm going to whisper something, and you tell me what I whisper into your ears. Okay?
How are you?
Okay. Okay. Thank you. So I can tell that you hear very clearly. Alright? And my next thing to do is to check the nose. Okay? I've done the ear. Oh, okay. Before we do the nose, I'm gonna do the Weber test and the Riney test. Okay? The Weber test is a test that we do for vibration, and the Riney test, we're gonna use the tuning fork for both. The Riney test is the one that we use for bone conduction. I will check that behind your ear. All right? Thank you. So bear with me. So I'm going to put this on top of your head and tell me if you feel any vibration. Okay? You feel anything? And does it feel like it's going away? Okay. I'm going to do that here. You feel any vibration? You feel like it's going away? Slowly? Okay. I'm going to do the other side too. Any vibration? Do you sense that it's going away? Okay. Thank you. So, the other test I'm going to do is, well, that and the, let's see, I'm done with the ears. Now we're doing the nose. We're going to check your nose for the size and shape and symmetry, and then I'm going to inspect the sweet tongue, the mucosa of your nose, and the turbinate. I'm going to check all of that, and I'm going to check the patency of your nose. Do you have any sinus problems? Any cough? I mean, any cold? Okay, now I see that the nose is right where it should be, the center of your face, and it's midline your face, and it's symmetric. So I'm gonna ask you to tilt your head back just a little bit, because I'm gonna look at your nostrils inside of your nose to see if we, okay, it's patent. I don't see any signs of mucus or, you know, signs of having a cold. And checking the other side. Yeah. It's patent. And I can see some hair follicles, which is normal, on both nostrils. I will now check the, okay, that was the nose. Patency and spectrum mucosa is pink. So that shape, and it's symmetric. Okay, so I will go back to the mouth and pharynx. That I already did. I was ahead of myself. So now I'm going back to check for your to the neck. Okay, I'm going back to inspect your neck. Now what I'm going to do with the neck is I'm going to inspect and palpate your cervical spinous and the strength. Actually did the strength of your neck and your resistance to the neck. I've done that. Palpates the sublingual, I've done. Occipital nose, occipital nodes, and palpate the carotid artery and the thyroid artery. Okay. So I'm going to do inspection. I'm going to ask you to bring your head back a little bit so I can have access to the neck. So your mandibular. I'm checking your notes here. Sorry, I'm sweating. Let me just wipe myself. So I'm checking for your nodes here. I'm checking for your occipital nodes, which are in the back of your head, and then carotid artery. I have to auscultate that, and your thyroid gland. Inspect, palpate, and all else. I'm gonna do the occipital nodes, which are back here. Okay. I can feel asymmetry. Symmetric. I can feel that. And okay. and inspect your, palpate your thyroid gland and carotid gland. We have any stethoscope. So, Elijah, before I auscultate your the carotid artery and the thyroid gland and the carotid artery, I would like to. I think I missed the swallow test. You know, I'm going to ask you to swallow and tell me if you feel any pain. Take a deep swallow of your saliva, please. Okay. Any pain? Say ah. Okay. And then I'm gonna try to see if you have your reflex, your swallowing reflex. Open your mouth again for me. Try to swallow. I'm gonna stick gag reflex. Okay, sorry I had to do that, but thank you. Okay, so now I'm gonna listen to your artery and your gland. I'm gonna auscultate carotid artery and thyroid gland. Okay, I'll just listen. And do the other side. Oh no, keep your head straight. Okay. Thank you. My next thing to do here is I'm going to listen to your lungs. I'm going to palpate your thoracic, anterior thoracic and posterior thoracic, and listen to your lungs and percuss. Okay, so now we're going to do the lungs. So actually, I'm going to ask you to, if you don't mind, to take off your shirt for me, please. And I'm going to put this over here. And I'm going to take your shirt. Here. So I'm inspecting your chest. Actually, I'm going to ask, can you lay down for me, please? If you don't mind. Are you comfortable? Okay. Inspecting the anterior chest. I see that it's even. Actually, I'm going to inspect and palpate. Well, inspect, I see that the skin is normal, it's brown and evenly distributed. And I can see your breathing normal. I don't see that you're using any accessory muscles. Okay, and I've done the inspection. And now I'm going to palpate your anterior chest to see whether I find any pain as I'm palpating. Okay. Okay, thank you. So now I would ask you to sit up, please. Yeah. Thank you. I'm going to also inspect the posterior. See that it's normal skin, brown skin, and really distributed. I'm going to also palpate to just see if I find any tubules, any discoloration. There are no discolorations. Okay, and the back seems evenly distributed. Okay, thank you. I'm also checking for and now I'm gonna palpate and you're gonna tell me, you're gonna tell me, say 99. I'm gonna do the front first. Can you say 99?
99.
Okay,
99.
99.
99.
Mhm.
99.
Okay. I'm gonna do the back too. Okay. Okay, keep your back straight. Say 99.
99.
Mhm.
99.
Okay.
99. 99.
Good. While I'm here, I'm gonna check for your. We've already done the tactile. With percuss the palpated tactile. So now, what we're gonna do is I'm gonna percuss your diaphragm and also percuss your lung field, which is in the back. Your diaphragm. Percuss. Mm-hmm. And percuss your lung field in the back. Okay, thank you. I don't hear any abnormal sound or feel any abnormal sound. So now I'm going to auscultate. I'm going to listen to your lung fields. We're going to start with the posterior, actually posterior and anterior lung field. I can hear your lungs better in the back, so I'm going to ask you to take a deep breath. Take a deep breath for me, please. Out. Another one. Out. Another one. In, out, out, in. Good. Out. Okay, I can hear your lungs, they're clear, bilateral lungs clear. I want to just check your anterior also. Take a deep breath for me. Okay, out. Okay, deep breath. Okay, deep breath. Okay, deep breath. Okay, all right, thank you. And now we're done with the lungs. Now we're going to do the cardiovascular. I'm inspecting your chest for hips and lifts and thrust. And I don't see that. Inspector, can you keep that chest straight for me, please? That's it. I see colors evenly distributed, and I can see hair on your chest. I also would like to auscultate your aortic area, which is the second right rib. Let me start with the point of maximum impulse, which is the fourth and fifth intercostal region. Okay, I'm going to start from the clavicle here. 1, 2, 3, 4, and midline, fourth and fifth. So I'm going to palpate here for that pulse of maximum impulse. I can hear that. Okay, and then I'm going to do auscultate for the aortic region and pulmonary. Okay, aortic region I'm going to do to your right, which is the second intercostal. So aortic, mid clavicle. Pulmonary is almost at the same level here. to your left. That's okay. Third intercostal is where your hips point is, and that's to the left. It's almost just above the pulmonary, just below the pulmonary. Okay. All right, and thank you. So now I'm going to palpate your brachial, radial pulses. I'm going to do all your pulses. Okay? See if you have strong pulses. That's your radial. I should have started with you. Okay. And temporal pulses. Okay. Good strong. So now I will do your and I'm going to palpate your popliteal, posterior, and dorsalis. I'm going to go down here and do the other pulses. Okay. Can you uncross your legs for me? I'm going to check for your popliteal. Oh, just flex it. Okay. Good. Okay. And your dorsalis, pulse. Other one. Okay. Okay. And then lastly, I will do the posterior tibia. On first. Okay. Thank you. Thank you. Have strong pulses all around, and so now we're going to do the abdomen. So I'm going to ask you to lie down, please. Again, thank you. I'm going to inspect your abdomen, and I can see that inspecting, I see that it's round, and your umbilical is in the center of your abdomen, and I can see that I don't see any discoloration or anything. The color is brown and evenly distributed, and a little bit of hair around the umbilical cord, which is normal. Okay, so after I inspect, and now I'm going to percuss. Okay, the percussion of your stomach. Okay, going to that. I'm going to percuss with the 4 quadrant. Alright, I can hear some even vibration, so you're good. I will do now also auscultate before I palpate your stomach, and I'm going to auscultate for vowel sounds. You have hyperactive vowel movements on all 4 quadrants. Thank you. Now I will do, after auscultating, I will palpate now. I'm looking for any abnormal swelling as I palpate your stomach. Do you have any pain in your stomach? Okay. And then we will move on to palpating the organs, the spleen, and the liver, and the rest of your inner organs. So I'm going to palpate I percuss the abdomen, percuss and then I will measure the liver and the spleen. The liver's on the right, and the spleen on the left, and the kidneys I will check at the back, percuss for the kidneys. So I'm gonna have to measure the lever. It's on the right. Let's see. Huh? Okay. I'm palpating so I can measure the lever here. The lever is on the right, just above the, a little bit above the appendix area. Okay. Lever, the normal lever is between 2 and 6, and I think yours is 4, because you're still kind of young. Okay, and now I am also gonna palpate the spleen on your left here. Because the spleen is just above the pancreas, over on your left. Okay. And I'm going to do the kidney, across the kidney. I'm going to palpate the kidney. Kidney is to your side, almost to your lower back. Any pain as I'm pushing on here? Okay. Any pain here? Okay. Thank you, Elijah. Can you sit up and take a rest? Thank you very much. Thank you. And now I think my next step is just to do your musculoskeletal exam. So there, are you cold? You want to put on your clothes? All right. Thank you. Okay. So the musculoskeletal exam is, I'm really just gonna inspect and palpate, inspect your joint, your bony areas, your elbows and your knees, and gonna look for symmetric, and also your shoulder strength. I'm gonna do and your elbow strength. Okay, I'm gonna start with inspecting all over. I see that your bones are evenly where they should be. Inspecting your knees. Okay, I don't see any, inspecting, it should be touching, but I don't see any asymmetry. I don't see any abnormality. Okay. I see that your knees is the same, and your shin, your bones are the same. Okay, so now after inspecting them, I'm going to palpate the joint. I'm going to palpate your elbow. Any pain? I'm going to palpate this side. I don't see any. They both look the same. Feel the same as I'm palpating. The wrist. Any pain on your wrist? Okay. Any pain here? What about your knees? Okay. Okay. What about your heels? Back of your heel? Okay. Okay, palpate. So now I'm going to do your elbow strength and your shoulder strength. Okay, I'm going to push down on your elbow, and you're going to try to bring it up. I'm going to push down. Okay, good strength. Okay, other side. Push down. Okay, and you're pushing up. Good strength. Okay. Elbows. Bend your elbows for me. Okay, I'm going to push your elbow forward while you push it backward for me. Good, good strength. The other side. Push. Okay, good. So now we've got the strength of the shoulder and the elbow, and the strength of your neck. We did that, right? I think we did that. Okay, and elbow strength, and wrist and hand strength. Do here, your hand. Put your hand like that. I'm gonna push, and you push forward too from your wrist. Okay? Okay. And I'm gonna push your hand down, and you try to resist. Okay. Alright, get that. I'm gonna do the same here. I'm pushing your knee down while you're trying to bring it up. Okay? I'm doing the same here. Okay, can you stretch your arm for me? Your leg. So I'm going to push it down while you're trying to bring it up for me. Okay? Okay, do the other side. I'm pushing your foot down while you're trying to straighten out. Okay. Alright, so do this for me. Your hand. Okay. And try to bring it forward. Your twist forward. Turn your hand. So, we're still doing the range of motion largely. So I'm gonna ask you to make a fist with your finger. Try to open and close them. Okay. And now, okay, thank you. And did we do the resistance? I'm gonna push, and you try to resist. Okay. Ow. All right. So please stand up, because we're gonna do the hip range of motion. Okay. Can you bend right and touch your toes? Okay. And while you're doing that, I'm checking your vertebra here, which I didn't do before. I don't know whether I need to do it, but okay. I don't feel any bumps. Okay, thank you. Straighten up. Yes. Can you twist while you're standing there? Go to the side. I'm checking your hip bone. Okay, other side. Other side. Good. Okay. Any pain while you're doing that? That's your range of motion. And can you bring the knee to the chest? Try to bring your knee to the chest up. Okay. Other side. Thank you. Other knee. Okay. Thank you. And so go back and sit down for a minute. We've done that. And now we're going to do the let's see, that's the musculoskeletal. Elijah, can you lay down for me? We're going to do the range of motion on the ankles, actually. Can you straighten out your foot for me? So what I'm going to do, I'm going to push, you push down with your feet. I'm going to push your foot up, and while you resist and push down, we're going to do the range of motion on the ankle. Okay, good. And now I'm going to push your foot down while you try to keep it straight. Good. All right, let's do the other one. I'm going to push forward while you push down. Good. Now I'm going to push down while you push up. Good. All right. So we did that. Can you sit up, please? Thank you. All right. So now we're going to do the neurological examination. The neurological examination is we're going to assess the your Bromberg signs. I'm going to ask you to stand up and with your feet, stand up please. Okay, feet slightly apart, and I ask you to close your eyes. And then this is the test. It's called a Bromberg test, but it's a test for your balance. When you close your eyes, do you feel dizzy, like you're falling forward or backward? Yes? You feel dizzy? A little bit dizzy? Just slightly. Okay, not much. Okay, thank you. And that's a Romberg test. And now we're gonna do the you can have a seat. And I didn't do your reflexes, so I'm gonna do that now. I'm gonna do your reflexes on your elbow. Okay. I'm gonna do your, just hang your hand loose. Okay. I see that you have a quick movement there, just normal. Okay, good. And do your reflexes on your knees. See that you're moving your foot when I do that. Good. A quick movement there, I noticed, which is normal. So now I'm gonna do the finger to nose test. Okay, and I'm gonna ask you. I'm gonna put an object on your hand as the sterogenous, and you're gonna tell me what kind of object I put in your hand. And then the other test is I'm gonna write something on your arm, and you'll tell me what I wrote on your arm. Okay? So first we're gonna do the finger to toe. You're gonna put your finger against mine, finger to nose. Put your finger against mine and put it on your nose. Can you do that? One finger, and quickly to your nose. Okay? Do it fast. Oh no, just one finger.
Oh.
One finger at a time, yes. Okay? Okay. Quick. Okay? You're gonna follow my finger though, and do that quick. Okay? Okay? Okay, thank you. Alright, so now I'm gonna put an object on your hand, and you tell me what I have in your hand. Okay, close your eyes. Tell me what you have in your hand.
Coin.
What kind of coin? Tell me. A penny. Good. All right, you passed the test. So now I'm gonna write in your hand, and you tell me what I wrote in your hand. Close your eyes. Tell me what I wrote in your hand.
F.
Right to the other side. Tell me what I wrote in your hand.
F again.
Okay, good. Good. So we've done that's the finger to toe. We've done the stenogenesis and the graphical test we've done. So sensory to touch, light touch, and assess position, and position sense and vibration sense. Okay, I'm gonna do light touch. Go ahead, you close your eyes, and you tell me. Do you feel that? Do you feel that touch? Do you feel that? Painful? Painful. Okay, good. Alright, so that's a light touch. And then we have the position sense. Okay, close your eyes again for me. What position is that?
Right. Right.
Speak loudly, let me hear.
Left.
Okay.
Left.
Okay, good. Alright, and now we're gonna do the vibration. Vibration. Oh, we did that already. Almost there, we're at the end. And we did the reflex test and ankle jack. I think we're done. Yep, I think we covered everything. Thank you very much for the didactic video test. Thank you.